Have you ever wondered how often you should see the chiropractor while you're pregnant? Let's talk about it today. If you're watching this video, the odds are you've already made a decision that you are interested in getting chiropractic care while you're pregnant. While this video won't necessarily cover the topic as to the benefits of chiropractic, we are going to cover the topic of how often should you go to the chiropractor while you're pregnant. So this really deals with the frequency of care. So let's start by breaking it up into really three categories. We have without symptoms, with symptoms, and injuries. So let's go over the three of those and help you better understand what recommendation you may receive. One of the factors why you should see a chiropractor without any symptoms is because of a chemical called relaxin. This is a naturally occurring chemical in the body. However, during pregnancy, it is greatly increased, and it is increased with a reason. This chemical will interact with cartilage and ligaments and cause them to become softer and more pliable. And this is important because it actually allows the pelvis to be able to stretch open wider to allow the baby to be able to come through the pelvis more naturally and have more space. Now, the downfall of this is as you progress in your pregnancy and the longer this chemical has been persistent and stronger, the looser and less stable the pelvis and the body is going to become because it is loosening up for the purpose of having the child. So with these recommendations that I'm going to present to you, they really take into the fact that as you progress in your pregnancy, the instability in the body is actually going to generally increase. And so because of that, the frequency of care is going to increase with it. Let's go over basic recommendations that you may receive from your chiropractor or you may receive from me if you were to come into my office. During the first 2 trimesters, really it's about making sure that the body is healthy and staying maintained and functioning. And so because of that, if you're a healthy individual and you don't really have any complaints, I'm generally going to recommend that you come in once a month just to make sure everything is aligned, functioning, and there's nothing new developing. Now, as you move into the last trimester of the pregnancy is really when the frequency of care is going to increase. And the reason it's increasing is because as you get further along that pregnancy, you're going to have greater stress on the body, greater instability, and greater risk of things kind of going awry and bad. And so we want to make sure that we're keeping the body stable, happy, and calm so that it stays there. So when the baby does come, that there is a properly functioning pelvis to allow that baby to come through. So during that first month of that last trimester, which is weeks 24 through 28, I'm generally going to recommend that an individual comes in about twice in that month. As you move into the next month, which is going to be weeks 29 through 33, I'm generally going to recommend that you come in 1 time a week for that month. Now, as you head into that last month all the way till the baby is born, generally I'm going to recommend that we pick up the pace a little bit more and get you in twice a week to make sure that everything's functioning and moving properly. And again, the reason why we're increasing this frequency is because as the pregnancy develops, as you get a bigger baby, as the body starts to relax and stretch, there gets to be a lot more instability. And so in order to keep it stable and keep it functioning, really you got to get that higher frequency. Otherwise, the body quickly goes out of alignment and loses its function. If you're presenting to the chiropractor with symptoms and you're already pregnant, the pregnancy recommendation is going to be a little bit different than the recommendation I gave previously. However, that recommendation is still the baseline recommendation. So if you manage to get out of symptoms relatively fast, that recommendation I gave previously is really what you want to refer back to once you're out of pain. Now, the reality of it is, depending on the symptoms you have, depends on how often you're going to need to initially get in. So basically, if you're coming in with symptoms, you're probably going to start out at a higher frequency, like 2 to 3 times a week, and then being tapered down to once a week until those symptoms are fully under control and manageable. Now, sometimes during pregnancy, that frequency doesn't fully go away because the pregnancy is aggravating whatever condition. In which case, sometimes that frequency is going to remain a little bit higher, maybe once a week through most of the pregnancy, just to keep those symptoms under control. And then as you move towards the end of the pregnancy, again, you're going to bump up your frequency, just like in my previous recommendation, where you're coming in twice a month, then once a week, and then twice a week. Now, if you're presenting to a chiropractor and you are pregnant and you've had some type of major injury, this is where the recommendation gets a little bit complicated and really has to be played piece by piece with the chiropractor. And the reason for this is that the severity of injuries is vast and varied, and sometimes it takes a lot longer to recover from things. So let's say, for example, that you're in an auto accident and you're pregnant. Well, now you got two major factors that are causing you discomfort, pain, and making you kind of miserable. Now, if you were just in an auto accident, the frequency of care varies greatly and often starts at 3 times a week and can last 3 times a week for a couple months. And again, it depends on how bad it is, and then it tapers down from there. Now, if it's a minor injury and you recover relatively fast, then maybe you'll be in twice a week for that first month, tapering down until things are under control. But in reality, the frequency of care, if you have some type of major injury and are pregnant, you are looking at a little bit higher rate of care. Initially, you're probably going to be looking at coming in 2 to 3 times a week until the symptoms get under control. And then probably after that point, you're going to be looking at coming in at least once a week for the duration of the pregnancy as you try to maintain the function of your body. One of the factors that's missed as far as pregnancy care is most people forget about the postpartum care of chiropractic. And this is actually one of the most important parts for the mother. And the reason for this is because it's going to allow the body to recover from the stress and whatever trauma occurred during the birthing process. And so my general recommendation I give to patients, if they've had a normal birth, things went really smoothly and there wasn't any complications, is that they're going to get in once a week for that first month and then every 2 weeks for 2 months after that. And the reason for that is we're really just trying to make sure that that body starts to function normally again, is in the right place, and is ready for you to move forward and live your life normally. Now, one of the big factors in postpartum care is, again, that chemical relaxin. After the pregnancy, that chemical relaxin continues to persist during nursing. Generally, within the first 3 months, the amount of relaxin is going to reduce drastically. And that's going to allow more stability and strength within the body to be able to stabilize and be able to function properly. Now, if you don't do any type of care and the pelvis and the body is out of alignment and you do nothing, and then that chemical relaxin leaves, now your body is actually going to have an issue where it may actually solidify and harden in a improper position. And so then you actually end up with what I see all the time, which is chronic pain after the pregnancy because the body is actually not aligned and it gets kind of stuck there because the body kind of hardens and solidifies where it's going to be and it's not in the spot where it should be. And so getting that postpartum care really does help in the long run, because you're actually going to allow that body to get back to the position where it should be and then hold that position, and then after the pregnancy actually be able to be in the right spot. I hope this has helped you better understand care recommendations for chiropractic during pregnancy. Down below, I do have links to my website and additional readings if you would like to learn more.